From Studio 3C in Rockefeller Center, this is News 4 New York.
Welcome back. Medicare is often a contentious subject, certainly an issue often argued between Republicans and Democrats. It is by definition a federal system of health insurance for those 65 and older and for those younger with certain disabilities. Medicare Part D adds prescription drug coverage to that and a number of other plans offered by insurance companies and private companies approved by Medicare. Patients' rights groups here and across the country have been talking with lawmakers for months about the risks associated with cutting funding in the wake of the fiscal cliff. And joining us now to talk about that is Seth Ginsberg, president and co-founder of Global Healthy Living Foundation. So Seth, thanks for being on the show.
Good to be here.
So this is a complicated subject, and it's one that people have been talking about because the idea in Washington now is it's time to rein in spending. That's what the Republicans want to do. And President Obama, to get that agreement on the fiscal cliff, has agreed to look at these entitlement programs. What exactly will happen, of course, we don't know. But basically the issue is Medicare is a huge program. Health costs are skyrocketing, and more people are now becoming eligible. So we can't continue on this path without changing something. So what, in your opinion, can be changed? Can anything be touched?
Well, yeah, lots can be touched, but to us, we feel you shouldn't mess with the things that work. And in the case of Medicare, and specifically prescription drug coverage, programs like Part D have, since their inception in 2006, come in under budget and have reined in costs, and ultimately have made our parents and grandparents healthier. So to us, the thought of having Part D and other Medicare issues on the chopping block is scary, and it's unfortunate.
Well, you guys say there is a disconnect between the thinking in Washington and how the public truly thinks. There was a poll recently taken involving Harvard University, and it really showed that people do not want changes to Medicare. And if that happens, they will likely become much more vocal. If there are any real concrete proposals, we're likely to hear a lot more backlash.
Definitely. And our hope is that families here in the tri-state area and all around the country are having conversations, multi-generational. Parents, grandparents, and their children and grandchildren should be talking about what they want. And the fact is, they want good health care. They want coverage. They want lower costs out of pocket for things like the medicines that they need to live longer and live healthier. So to us, I mean, it's really unfortunate to even have this conversation, that we have to protect something as dear to us as Medicare, but it's important, and it is, you're right, the convergence of politics and policy right now.
What are your biggest concerns in terms of what has at least been floated as proposals? What do you think could hurt the most?
Well, we think that when prescription drug coverage is altered, the way it's potentially proposed to be in Part D, it ultimately will raise out-of-pocket expenses. And we know for a fact, study after study shows that the more expensive your out-of-pocket expenses are for things like medicine, the less likely you are to take them, the more unfortunate your future will be, and the less healthy you'll be. And, the other proposals discussed about the reimbursement rates for physicians, for example, are equally devastating. Physicians work hard, and to cut their rates or reimbursement rates is something that we fear could potentially stymie access to care. Doctors won't want to be doctors anymore. So it's very troubling, and it's, as I said, unfortunate that we have to have this conversation in the first place, but we want to make sure people have that conversation with their congressman, with their senator. Let them know what it's like for us out there.
Okay, well, surely the debate will get even louder as this is discussed on Capitol Hill. Seth Ginsberg, thank you so much for coming on the show.
Great to be here.
Giving us a little clarity. Still ahead, honoring a civil rights pioneer forever.